Hi there. My name is Saurabh Verma, and I'm one of the junior doctors at the Ipswich Hospital NHS Trust. The ophthalmology department here at Ipswich have been currently doing an audit looking at eye care in the intensive care unit. So this audit is based on current guidelines for eye care in the ICU. And this is a guideline that has been produced as a joint collaboration between the Royal College of Ophthalmologists and the Intensive Care Society. So as a part of our audit, we provided questionnaires to our ICU nurses and just going over how aware they are of these guidelines, how confident they are at administering eye drops and ointments, as well as how well they can recognize ICU-related eye problems and how they can deal with them. So a key theme in our questionnaires showed that there was a lack of formal training in ophthalmology, as well as a lack of awareness with the current guidelines amongst our ICU nurses. And this manifested itself in a lack of confidence in terms of being able to recognize ICU-related eye problems and a lack of confidence in how to manage them. Naturally, this led to a greater desire for more training around this area. And this is what this video is exactly, just a brief overview of the current guidelines for IC-related eye problems. The main content of our talk will involve going over how to try and prevent IC-related eye problems, and should these measures not work, how to identify these eye problems and how to manage them. So prevention of IT-related eye problems is more relevant to unconscious patients who cannot spontaneously open and close their eyes. The reason this is important is if there is any exposure of the eye, then that can lead to risks of dry eyes, can lead to risks of deformities in the lining of the eyes, which can then leave a patient susceptible to things such as infection of the eyes, as well as damage or perforation to the eyes as well. So in terms of grading how well a patient's eye closure is, there is grade 0, where the eye is completely closed, grade 1, where the conjunctiva is exposed, and grade 2, where there is corneal exposure. So the reason we do this is this influences how we do manage a patient. So in terms of grade, you don't need to take any action at all as the eye is well protected and it should ensure that it remains well lubricated. In terms of conjunctival exposure or grade 1, you do need to lubricate the eyes often. And in terms of corneal exposure, well, that will also require lid taping as well, as with grade 2, this is where they become more susceptible to perforation of the cornea. So in terms of lubrication, you can use simple things such as Lacrylube to help lubricate the eyes. And going over how to administer eye drops and ointments, the first most important step is to bathe the eyes in warm water and using gauze as well. This is just to wash off any residue from previous ointments or eye drops and therefore ensure you're able to get full coverage of the eyes. Then it's important to examine the eyes, and these are for things such as redness or corneal opacity, as well as swelling. And the reason for this is just to ensure there is no ICU-related eye problems. Once the checks are in place, you can then administer the eye drops or ointments. So first of all, pull the lower eyelid down as demonstrated in this picture here. Then apply the ointment along the top of the lower eyelid. And in terms of lubrication, you just need to repeat this every 4 hours. So in order to apply tape to the eyes, the first and most important check is to make sure eyelashes are on the outside. If the eyelash is on the inside, then that can lead to risks of abrasions to the cornea and damage to the conjunctiva. Then make sure the outer surface of the eye is dry, so this can ensure your tape can stick. And usually the guidelines recommends using something like micropore and just applying it horizontally as demonstrated in the picture here. To identify ICU related eye problems, I've just gone over a few key things that can occur. First of all, this is what a corneal abrasion can look like once a fluorescence drop has been applied. And this is why we put the measures for patients who cannot close their eyes spontaneously. So this is a corneal abrasion. These are, as you can see, there are scratches to the surface of the eye, and they usually present as red and dry eyes. So, and actually, because the epithelium of the cornea has been disturbed, there is risk of infection getting into the eye. Furthermore, just with small damages, it can become larger damages, leading to perforations. In terms of picking up corneal abrasions, the best way to manage it is with chloramphenicol. You apply these ointments 4 times a day, and this should be for 5 to 7 days. And just ensure frequent lubrication of the eyes as well. Again, just to reiterate the point as well, if there is a grade 2 lid exposure, then ensure the eyelids are taped. In the picture here, you can see that there is swelling in the conjunctiva. This is what is known as chemosis. Now, this is something that can impact how well eyelids can close, and this is something you can see in the ICU. So there are certain risk factors in the ICU that can be associated with this, such as compromised venous return. So one example is when placing an endotracheal tube that can compromise the venous return from the conjunctiva, leading to this swelling. Next, you can see this in patients with generalized edema if they have a low albumin level or they've come in with severe fluid overload. You can see this in these patients. And finally, if a patient has capillary leak, more commonly associated with systemic inflammatory response syndrome or sepsis, they can also present with chemosis. So it's very important to ensure an ICU doctor can review this patient and try and assess for these common risk factors in order to try and reduce the swelling. Finally, these pictures here represent conjunctivitis. So this is an infection to the conjunctiva, and it usually presents with red, sticky eyes with discharge coming from it. So in terms of managing it, it's important to swab the eye discharge and send that for a microscopy and sensitivity and culture, and ensure you remove the discharge with warm water and gauze. In terms of management, there shouldn't be a delay to wait for the manage with chloramphenicol ointments 4 times a day for 5 to 7 days. Now, this should improve within 48 hours. However, by that time you should receive the results from your culture, and if there is no improvement seen, then you'll have to switch over to whatever the sensitivities are showing. However, if there is improvement, then the guidelines usually state it's okay to continue with the chloramphenicol ointments. So this is a condition called microbial keratitis. This tends to occur when conjunctivitis has not been treated appropriately. We tend to see this in patients who have been started on chloramphenicol but do not improve in 48 hours. Patients who may develop this are those who have had damage to the cornea. One example being corneal abrasions from exposure of the cornea, which can then lead to a subsequent bacterial invasion into the cornea. So microbial keratitis can cause the cornea not to reflect light that well as develop white patches on the corneal surface. it is very, very important that ophthalmology are contacted when microbial keratitis occurs, as the more you delay, the more likely a patient can develop corneal ulcers, more impact it'll have on their long-term vision, and the greater the risk of them developing a corneal perforation. To just summarize the things that this video has gone over, I've gone over all the rationale behind the eye care guidelines, particularly why there is now a set pro forma for patients who are unconscious and unable to close their eyes properly. The importance of regular drops such as Lacrolube to exposed eyes to ensure that there is adequate lubrication to prevent any abrasions to the cornea, to prevent any risk of infection, as well as risk of any perforations. To recognize when these complications arise and when to escalate this for further help.